Tired of dealing with vein disease? Have your symptoms gotten worse?
Oh, these spider veins are ugly.
My legs and ankles are always swollen.
My legs are tired of standing all day.
While some symptoms can be managed by lifestyle changes, other factors are out of your control. Get help from the experts at Vein Clinics of Hawaii. To learn more about your treatment options, call 427-5565 or visit veinclinicsofhawaii.com.
Aloha, Hawaii! It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and Medical Director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Well, hello there. Thank you very much for joining us. If you've been here before, welcome back. If you're a newcomer, glad to have you aboard. As you know, or if you had been with us in previous times, Vein Clinics of Hawaii is statewide. Started on the Big Island and worked its way here to Oahu a few years ago, Kauai and Maui and the Big Island. So you're never too far away. And it's very, very interesting what's happened. As we first started doing the program, one of the best shows that we've done, or most of the really fun shows we've done, is when we can include a patient. And that's what we're going to do today. We have a special guest joining us in just a bit. To share her experience with the doc and what she is looking forward to as she goes on her treatment path. And that being said, I like to every now and again when I can remember to ask you, Doc, what was the originating circumstances that came together to get you interested in this particular part of medicine?
Well, you know, my background is in cardiac and vascular surgery. I had been doing that for a fair amount of time, you know, I was attracted to cardiac surgery just because of the fact that the anatomy of the heart and the chest is, you know, so interesting. It's a very dynamic organ. I mean, there's always, you know, new stuff coming out. So that was intriguing to me, and I, you know, loved doing it for the amount of time that I did. And then I was also doing what's referred to as peripheral vascular surgery, which is, you know, vascular surgery having to do with arteries. Mm-hmm. You know, right now we do all vein kind of work, but back then I was doing arterial kind of surgery. In that, you know, we do that in the hospital, and it's mainly a hospital-based kind of practice. But during that time, I always was involved in working with veins in one way or another. Mm-hmm. I mean, we always treated venous disease to whatever extent we were able to. So I think, you know, as time went on and I gravitated more toward vein disease, it was sort of a natural progression. But the thing that happened in the world of vein surgery is that over the past 15 years or so, we've had all sorts of new devices and ways to treat venous problems that are so much easier for not only us, but the patient also in getting them treated adequately and feeling better.
Yeah, interestingly enough, you know, people that walk into a radio or TV studio where I work, they're amazed at the change in the equipment over the years. And the same thing would happen to a vein patient. It's a whole new ballgame. And that's the thing that makes it interesting to me is 99% of what we're doing here on the radio and the new patients that come into Vein Clinics of Hawaii, they come in for a procedure, they walk in, they walk out. Mm-hmm. I mean, you know, I remember my late mom, rest her soul, that when she went in to have veins stripped, that she was in the hospital for a few days and then sometimes in bed at home for a few weeks. Right. And that just is no longer. No way. And that was very typical. That's a very typical story for being treated back then. And that's one of the challenges that we have now, because so many people remember their, you know, parents or grandparents being treated in that way, and they are very, very reluctant to come see us. Well, so we're not anymore. And one of the things that's really good about that, and we talk about that in many respects, and there's two different kinds of surgery. Some is elective that you decide to have for yourself. That's to make yourself look better, maybe feel better about yourself, more confident that you don't have these veins on your legs that people want to say, Jesus, do those hurt? Or wow. And today is kind of that in double respect. But I'm thinking that a lot of your patients, including the one we're going to meet, they start off with something that may be cosmetic in nature, wanting to just look better. And then they find out, since we're here, can't we take a look and see if I am either suffering or may suffer additional stuff that is not so much cosmetic but functional?
Right. Yeah, very much so. Luckily people do get superficial signs of, what we call venous insufficiency, because a lot of the time people will have symptoms and they're not even sure, or they don't know. They just frankly don't know that it's due to poor vein function. When we, which is another reason why I kind of, drifted into the world of vein surgeries, because, symptoms and problems that people have with their legs related to venous insufficiency is every bit as dangerous and altering to their lifestyle as arterial problems. And that's something that we really didn't appreciate all that much in the past. Now we do. People find the superficial stuff, aggravating because they don't like the look of it. But then they find out, gee, that's just a part of a whole bigger problem. And the other thing is that the symptoms of venous insufficiency come on so slowly and over such a long period of time that people tend to get used to those symptoms.
I don't. What do you mean hurt?
Yeah. So all the time we hear people say, "Gee, I didn't really appreciate how bad my legs felt. Now that they're fixed, they feel great." Yeah.
I do want to say one thing, and then we're going to meet our guest, and that is, and I've learned this over the time with Doc, that if you do have these spider veins that we're talking about, that does not mean that underneath them is a bunch of problems. Sometimes that's all you get. Mm-hmm. And so sometimes if somebody goes in to get a spider vein condition treated, they're not going to be sold a bill of goods saying, okay, now we got to go inside and get the stuff that's under there, because it may or may not be there.
Yeah. Sometimes we check. I mean, sometimes people come in with just spider veins and absolutely no symptoms whatsoever, right. And that's all we do. We fix their spider veins. It's kind of on a case by case basis. But yeah, if spider veins is all they have, then that's what gets treated.
Yeah, and you know what? A lot of it is the self-esteem, and put your right foot forward, put your left foot back, and all of that stuff. Particularly here in Hawaii, we're outside, we're tennising, beaching, sailing, fishing, golfing, walking around. So I'm curious as to, first of all, I want to get into our guest, Doc, because we just love spending time with people that are either being treated or looking at treatment or have completed the treatment. And Susan is with us. And Susan, have we talked about you a little bit?
Good morning.
Good morning.
Yes.
It's very interesting to me is what we'll talk about Dr. Juleff in a minute, but what was it that originally got you wanting to look into your veins or your legs?
Well, I'll be honest with you. Originally, it was the exterior sort of bulging and ugly looking veins that I had on my legs that just made me look and feel older than I really am.
When do you recall when it started? How old you were?
I was pretty young, probably in my late 30s when I first started noticing the veins. And so I wouldn't wear shorts. I wouldn't wear a bathing suit. I mean, it was pants all the time.
Yeah, and Doc, we've really heard that a lot, right?
Oh, yeah.
And the thing she just answered the question, 30s. We're talking about sometimes teenagers that develop spider veins or interested in getting rid of them.
Sure.
So what were you worried about it from a health standpoint, or was it just cosmetic?
Not at that time. It was sort of just cosmetic, at that time. But then as time went on and I got older, I did notice a lot of heaviness in my legs, a feeling of maybe I had a couple of weights strapped to my legs when I would wake up in the morning. And so I knew there was probably something to it. I wasn't sure exactly how it worked until I met Dr. Juleff.
What was the condition, or what was it like when you first, what did you give up first because you were worried about how it looked?
Going to the beach.
Okay. Yeah.
And that's a huge one.
Yeah, you bet it is. Yeah.
Yeah, and I'm shocked because even here in Hawaii, you can't imagine how many people come in, primarily women, who say, "Oh yeah, I haven't worn shorts for 10, 15 years."
Yeah,
and it shocks me because that's how much people dislike even just the appearance. It really alters your quality of life.
Yeah. And that's one of the things that's restored. So I can already tell we're going to get into that. But did you venture out right away when you first started getting treatment? Whoa, I like this. I'm going to go play tennis. I'm going to wear some shorts.
Yeah,
good for you.
I actually just finished my right leg. It's still in the healing process, but those big veins that were there are gone.
Yeah.
And so I'm
Isn't that
very,
amazing?
very excited about the future. Yes.
When you say gone, I had a unreasonable expectation that they went the same day. You go in, do whatever you're going to do, and then walk out with beautiful legs. And for a while, mine looked worse. But the doc did tell me, hey, it's going to look pretty bad, but trust me, in a couple of weeks, it's going to look great. And that's how long it took, and then it was perfect.
Yeah. It takes some
Okay,
time.
so what, if any, misapprehensions or fears did you have? Was there any vein conditions in your family?
Yes, varicose veins run in my family. My mom has them. Her mom had them. And I guess so one of my fears was just the unknown. And I had actually a nightmare the night before I went in. I dreamt that there was blood flying everywhere. Yeah. And that is so not how it is.
Yeah. That's kind of neat, Doc, because I remember we talked about spontaneous bleeding when somebody's in the shower or something, they start bleeding, and they run to get some help, and all they really have to do is sit down and put their leg up in the air a little bit. Sure. But you can understand, you're a professional, so you've seen every possible condition there is. But for us patients, you panic out. You think, holy smokes, what's going on with this thing?
Sure.
Or wait a minute. He said it was going to look at these things. Look at all these splotches. When are they going to go away? Well, they did.
Yeah. I think, with respect to the timeline, Susan's timeline, I think it's worth noting that she obviously had a very strong family history. Your mother, her mother, your grandmother. What about your father's side?
What about
of the
men's
family?
side?
I'm not sure. I don't think so because I have a half sister that came from the same dad but different moms, and her legs are flawless. She makes me sick.
Right.
So I don't think it came from dads. I think it came from moms.
It's like maybe people are playing roulette. They want to skip a sibling.
Yeah.
And there's 2 with veins and 2 okay.
Right.
That's kind of how it is in my family. My one sister and my brother, no problem, and my sister and me, problems.
Yeah.
Anyway, but I think what the audience would like to know, and I certainly acting on their behalf, was it must have. Was there a straw that broke the camel's back? Did you want to just get up one day and say, you know what, I'm not going to do this anymore. I'm going to go get this fixed?
Yes, I actually did, and I saw a commercial for the vein clinics, and I was like, I'm writing that phone number down right now. I'm calling right now, and that's what I did.
Well, and we should go back a little bit too, because this was not Susan's first entree into treatment. So you probably started developing problems when you were early 30s.
Yes.
So that was a good 5 or 6 years ago, right? So then after that,
he can lay it on.
Love you, Dr. Juliff.
Yeah.
So you had problems for a good number of years.
Yes.
We won't get into details, but you had a problem for a good number of years before you sought help initially. Now you sought help initially about 10 or 12 years ago.
Yes.
So you had primarily varicose veins?
I have spider veins. Those are still there. We'll talk about that later. But the varicose veins, yes, started in the 30s.
Yeah, and then so that's what you were originally going to the first vein clinic that you went to, and they did primarily injections.
Yeah, they did a therapy, a sclerotherapy on me, where they injected the medication directly into the vein.
Into the varicose
I think that's a
veins.
little bit different than how you folks do it at the vein clinic, but that's exactly what they did. They injected the veins. And
the varicose veins, for the most part, went away for some short period of time.
For a few years,
But then they came back.
They did, with a vengeance.
Let me ask you about your symptoms. The first time around, what kind of symptoms were you having? Same sort of thing as you had this time?
Not exactly. The first round was a little bit different, more of an itchiness, and I think they were just starting at that point, so it wasn't the long-term sort of heaviness that I got later on.
Okay.
Yeah.
So
interesting to me too, and if you don't mind, Susan, because I'm also a patient, is that I anticipated. First of all, I thought the same ones came back, but that does not happen. So what happens is whatever condition caused you to get the varicose veins in the first place, that condition came back. It wasn't the same vein. Did you think they were were they in the same area?
One area the same, yes.
It's right in the same area.
Right in the same
area. Because, Doctor, you've explained that to on other programs and with other patients, that when we fix that vein, that vein's done. But it may recur, but not that vein, but a new one.
Yeah, for the most part.
Yeah.
For the most part, and it depends a little bit whether you're talking about the more superficial veins or the the deeper veins. But the answer is the same for both. The deeper veins, there is a very, very small percentage of the time that vein may reopen and become a problem again. Shouldn't happen very often. But yeah, with respect to spider veins and especially varicose veins, because for varicose veins, we do something called microphlebectomy, which is to make just little needle puncture sites along the course of the bulgy vein. And we've got special instruments that we actually extract those veins, those varicose veins.
Take them out,
so
right?
they're gone. They are not going to recur. But that is not to say that you can't develop further problems in the future. And as you say, you might develop new superficial veins. Spider veins the same way. If they go away, then they're gone. But you might develop more spider veins in the future. That's for sure.
And and I guess that can be discouraging. So hey, wait a minute, I thought this was done.
Right.
So but what about now? Now you've had one side's done, right? And so you have an expectation. There's a coming back. Was it ever a consideration, like it is with some patients, as was with me, is how many of these things can you take out before I start not having as many patients I need?
Yeah, I thought that too.
I'm happy with the answer, by the way.
I was like, wow, don't you need a certain amount of veins to carry the blood back up to your heart?
Yeah.
But I guess these are like little side streets, they're not like the main avenue. That's kind of the way I was explained it.
And the way he explained it to me and other patients too is, don't worry, another one's going to be made. And alley will develop because the body knows that blood's got to get back uphill somehow.
Yeah.
Right.
So when you say that you've done one, Doc, is that pretty normal? Is there like times where you can't do both because there's a lot to do? You can't do it all at once?
Yeah. That basically that's what it boils down to. We kind of divide things up a little bit to make it as easy as possible on the patient. But we did see evidence on our original ultrasound that we did for Susan. We did see evidence of her treatment from before. So even though, and we see this all the time, even though she had what seemed to be, and basically was more superficial injections into varicose veins, the medication that she was being treated with, which is meant to close down that vein, actually made its way into the little deeper system, and a portion of one of her saphenous veins was actually closed as a result of those injections. Now, my question would be, gee, maybe you had more reflux even then, and not all of the problems were being fully addressed. And we see that all the time too. We see people who have been treated in one way or another, and it's hard to know because unfortunately, venous disease is a progressive kind of problem. It doesn't go away. It's in your genes, and we treat everything that we can when the patient arrives, and then we just kind of monitor from there.
What sort of any discomfort did you experience after the treatment?
I was expecting way worse. The discomfort was. Really,
it was for a week.
It was really mild. I was pleasantly surprised. I got home and I didn't, I don't take ibuprofen or anything like that, so I was fine.
I think that's the part that we really want to impress on somebody, and that is that you walk out feeling better pretty much right away, and there's very little, if anything, you can't go ahead and resume doing. What was the first thing, just out of curiosity, because when you first decided, I'm putting on these shorts, I'm going out today. How long, what sort of a feeling did that do? How did that help you?
Well, it's helped me feel a lot better about myself, a lot more confident. I have a much younger man in my life,
and
so you. I felt like I was sort of feeling a lot prettier. Yeah,
and Doc, pretty is as pretty does, and it's great that you have that. But in many respects, the prettiness part is a bonus for the other part, which is you're getting rid of something that could be a chronic problem.
Sure. Yeah. A chronic problem and a medical problem.
Yeah,
I mean, it's considered a true medical kind of issue. But yeah, we treat the underlying cause for all of that, and not only are you being treated for the symptoms that you're having related to that, but also hopefully in the future you won't be developing those more superficial signs like varicose veins and even spider veins in some instances.
Susan, I think that it'd be kind of neat if people should know what level of expectation you had, based on, all right, you listen to an ad and that got you rolling. Mm-hmm. And that's what we do. By the way, it's veinclinicsofhawaii.com. Go look at that and see examples of all of us, or some of the befores and the afters. But I'm thinking that what have you shared like with friends since then?
Oh, I show my leg.
Yeah.
I show my leg.
Good for you. Yeah.
I showed my leg to some coworkers, and they were like, "Wow, wow, that's amazing." Yeah. I showed them before I had it done, and then after I said, "Now there's some bruising, but that goes away."
What sort of decision-making process was it? For instance, one thing that I'm really impressed with Doc's office is that you get your own iPad, and all these things. You answer how you're doing it.
Sure.
And I thought, when you talk about symptoms, I might itch and you might throb. It's the same problem. Mm-hmm. But we all, some say, oh, my leg's burning. The other one says, my leg's tingling. What were some of the things that you would say, not just about the looks, but I don't like this feeling? Mm-hmm. What were some of the feelings you experienced?
Definitely the heaviness in my legs, the burning and burning.
At any particular time of day or night?
All the time.
Wow. Okay.
It got to the point where it was just all the time.
Yeah, wow.
I would massage my legs at night, and not a good feeling.
Doc, when I heard her say that when we talked off the air, is sometimes massaging not a good idea, depending on what the condition is? One reason the massage might be it's a muscular thing that you think you're massaging.
Yeah.
And in fact, can you damage or can you cause any trouble with maybe over massaging?
Yeah, not really.
Yeah.
Not with respect to the the basic cause for venous insufficiency. Are you going to make that worse? No. Are you going to cause it if you don't already have it going on? No, not just from massage. With respect to vein problems, probably the only time that we recommend that you not have massage is if you've got a blood clot.
Yeah, of course.
And even that, it should be a fresh blood clot. Then, we kind of avoid massage. But otherwise, no, you're not going to affect anything.
But that's kind of interesting because I guess, once you did that, we're kind of interesting, we humans, that, I think leg elevation is something that we automatically do because it makes you feel good. Did you do that a lot?
Oh, yeah. I would put a pillow under my legs at night and sleep with my legs elevated. Yeah.
And I did that too. And then Doc says, well, how much do you elevate? And he said, you're wasting your time. Your foot's got to be a little bit higher.
Higher than your heart,
Higher than your heart. That was the key. So reducing it. Taking away one pillow will do it sometimes, but I still think that some of those things we kind of know, but then don't we get to a point like I did, maybe you did, where it makes me feel good, but it's not fixing it. I want to go get fixed.
Exactly. Yeah. Exactly.
And also why? Unless this is another hurdle that we always have to get over, and that is that there's a lot of symptoms referable to venous insufficiency that people don't automatically connect with vein problems. If you have big varicose veins and you have symptoms sort of in that area, it's a pretty easy connection. But people who have plenty of people out there have perfectly normal looking legs. But they might have the symptoms of venous insufficiency if they have that underlying problem. Now, another problem that you had was restless leg syndrome.
Yes.
And go ahead and tell us how you felt about that.
Let's find out exactly what it is. But I'm guessing that a lot of folks that have it don't know they have it. Somebody else says, "Hey, what did you know of it?" And then what did you experience? What happened to you?
I didn't know much about the actual condition. I just knew that I would move my legs around a lot, shake them up and down, move them, feeling like I couldn't really sit and relax and watch a movie. Like I needed to be up and walking around.
Wow, yeah. What causes that, Doc?
Well, the reason for that is that the veins in our legs are very dependent on muscular activity to work. We've talked about the fact that the heart pumps blood into the arteries, and blood flows through arteries because the heart's pumping. Well, this same is not said for
no
vein
pumps
flow.
down at the bottom of the veins.
It's not like we have thousands of little hearts down there. So One of the a couple things. There are one-way valves in veins, and those are very, very important in keeping the blood flow moving in one direction, which is upward. Should be upward. As those valves fail, which is the basic reason why people develop venous insufficiency, then the blood starts to settle down. However, when you are active and when the muscles in your legs are contracting, there's a beneficial effect for blood flowing in the right direction, upward. So when people have venous insufficiency, blood is settling down into the leg. We get what we call pooling, too much blood kind of hanging out in the lower leg especially. And people just learn that, moving their legs around in contracting those muscles helps move the blood up and relieves the symptoms. So there's a pretty wide spectrum of symptoms that go along with restless leg. It may be as little as, when you're sitting around, you might be moving your legs a lot and your feet up and down because, and not in a jittery kind of way, just kind of moving your foot around because of the muscle contractions. Some people have it even worse, and they find that when they go to bed at night, they have a real hard time getting comfortable. Especially with their legs, and their legs are, either unconsciously moving or you're consciously trying to move your legs, trying to get them comfortable. And it will even get to a point where it will awaken people from night.
I was going to say, did it ever wake you up?
Oh, yeah.
Yeah.
Definitely.
Yeah. What about corresponding thinking, well, I'll stretch it and it'll feel better, and then you get a cramp? That's what happened to me.
Been awakened many nights with a muscle cramp.
Yeah. But one of the first things I can tell you is, hey, I'm not having these anymore. And so that was a big thing. But I think also my complaint or my symptom that I used to write down was it makes my leg go to sleep, or tingle. Or when I stood up, it would be sort of numb. And I thought there's just any number of ways everybody describes their symptoms, right? Mm-hmm. So yours was basically throbbing.
Throbbing.
Yeah, and that heaviness.
And the heaviness. Yeah.
Doc, do some people think that this isn't a vein problem, it's a muscle problem, I'll just massage my legs? And
Yeah. Again, that's therein lies the problem. Yeah. And, restless leg syndrome is one of those symptoms that hardly anybody connects with venous disease,
Yeah.
And then another one is cramping. You mentioned cramping. That's a very, very common symptom. And, restless leg can really alter your quality of life, quality of sleep, etc. Well, cramping is another one that, especially in the older population, some of these older folks, they can really have bad problems with cramping in the middle of the night.
You'll notice, Susan, the doc's looking at me and shaking his head like, I know about this guy. But it's true. And sometimes it got to a point where the common remedies to make it stop didn't. And it was really, really painful. And I just thought, hey, this is not right. This can't be happening to me every night. Mm-hmm. So any notice in reduction or disappearance of that?
I haven't had a cramp since.
Hooray.
Hooray.
Right? Yeah, that's like they say in the movies, that's worth the price of admission right there.
Yeah.
What did you expect? What sort of results did you expect?
Well, when I saw the ad, I looked at the before and afters on some of the people, and I thought it was amazing.
I thought
it was amazing. Yeah. And although mine wasn't as bad as some of those that I saw, I definitely, I was expecting for it to hopefully be gone. I was pleasantly surprised that it is.
I'm glad you said that, because I think that sometimes those pictures are to really give somebody a very glaring before and after, or what happens.
Sort of worst case scenario.
And so when you take a look at that, you say, okay, mine aren't exactly like that, but I think I'm going to get them done before they get like that, because I'm worried about the progression. Doc said earlier, unfortunately, venous disease is very, very slow to develop. We just don't see it coming. But you saw it coming from initially, I guess, from a cosmetic standpoint.
Mm-hmm, yes. And
now you're looking at it more as dealing with possible disease that's under there.
Right, health-wise, yes.
Wow, that's terrific.
Yeah.
Doc, I imagine that's a learning curve that you prefer patients to be at, because, you have your offices set up in Four Islands just to do your legs look nice cosmetic surgery all day long.
Yeah.
Not cosmetic, but strictly the, elective cosmetic stuff.
Sure.
However, that it may be a good thing, because people say, hey, you know what, just out of curiosity, can I have an ultrasound on what's going on inside where I can't see?
Mm-hmm. Yeah, for us, the most rewarding patients are the ones that are most advanced in their venous disease. And Susan's going to get a tremendously good result, too, not only symptomatic, but also, aesthetically. But there's a whole host of people out there with chronic skin problems. It's more than just an aesthetic problem. It becomes, a situation of skin breakdown, tissue loss, et cetera, and that's another population of people that have no idea that it's due to their venous insufficiency. And when we fix that and we get those ulcers healed or whatever, it's tremendous.
I'm thinking, Susan, that your primary care doctor and stuff may not be they're not as well versed as a specialist is. But sometimes somebody will get treatment for something that they think, well, this will make it go away, and it didn't. You probably knew that. How much communication did you have with, say, friends and others that had varicose veins that did something about it?
I had a coworker that had some veins done. She had them done not a different way, though. She had her stripped.
Yeah.
And she showed me a picture.
That hurts just hearing it.
Hers were really, really bad. But then I got support from my primary care physician and a referral, so I was happy about that. I shared with her what was going on, and she was happy to refer me out.
Doc, isn't that probably somebody that comes into your office expecting that you're going to say, my PC said this, what do I have here? Isn't that a patient that, at least on the surface, looks willing or is desirous of looking into getting help?
Oh, yeah. It always helps if we have, confirmation or support from the primary care physician, because often, if the primary care physician is sort of obstructive or doesn't want the patient to move ahead with the things that we're advising, it gets in the way. But most are not. Most are very cooperative, and it's that much easier because many people have had an ongoing relationship with their primary care physician for many years often, and they're just coming into our office for the first time, and we're laying a whole bunch of information on
but
them.
I think that's important, because give me, and so a lot of our audience just either sees a TV ad or listens to this program. They haven't been into an office. My feeling here in the Honolulu office, and I know the others are very similar, was one of, I think I'm in the right place.
Oh,
absolutely. I saw happy people. I see, there's displays. I think I have a lot of magazine covers. Doc has a lot more magazine covers. And it just, to me, it lended to not just the credibility of the practice and the doc, but that I'm in a good place. I'm going to get some help.
Oh, yeah. I felt very comfortable, very welcomed. And I saw all the magazine covers, and I was like, this guy knows what he's doing. I am in the right spot.
And those are real magazines. You used to be able to get those.
Ooh, don't give away my secret.
I remember when I was in high school, there was a magazine called Mad.
Yeah, I
Everybody
love
used to
that
remember
one.
that.
Yeah.
And there was a thing a coupon in it, and 3 or 4 of us sent away. It was like $20, which is a fortune, right? And you get your face on the cover of Mad Magazine
instead of Alfred E. Newman.
Yeah, exactly. Who me worry, whatever. But Doc, look, we don't necessarily want to make light of this and get anybody or everybody to have the impression that what you have is a warm and fuzzy feel good place that is in business to make people look better. In that's just a bonus, isn't it?
Yeah, well, that's a bonus for sure. And those people who are coming in just with respect to the vein side of it, those people who are coming in for just strictly aesthetic reasons and they don't have a medical problem, they're in the vast minority. 90% of our patients are patients that have a true medical issue, and that's what we want to address.
Yeah, but I'll tell you one thing. I don't know, Susan, if this is true for you. Sometimes when I've been there, waiting, I see someone. Hey, I think I want to do that. Because once again it goes to the self-esteem and able to do more things. Instead of a declining spiral of inactivity, you get to see what can I do next. So let's talk a little bit more about. You've had one leg done. You have another one to do. What?
I'm doing the second leg today, actually.
Yeah, as a matter of fact, depending on what day you're listening to this, she's either done with it or she's having it the same day you're listening. But interestingly enough, what I think is important is when you first started getting your treatment, what were the expectations and what have you ended up with? Obviously, you're happy because you're coming back.
Yeah.
So let's find out how happy.
Yes,
Yeah.
the expectation was that I could get help for after I was educated for the vascular disease, and that the exterior part, the cosmetic part, would be addressed as well. And both of those things happened for me.
Are you a traveler? Do you like traveling?
I do like to travel.
Yeah, because I do know that as we get into my category, Doc, the traveling, if you have a venous condition, is not a good idea, which means that when you get treated for something that's superficial and then you get into it, you learn more things. Like, this is not, I'm not doing this because nobody can see that big thing inside my leg, but I know it's there and I don't want to get hurt.
Right. There's a number of different reasons why we treat venous insufficiency. The first one is because of the ongoing symptoms. The second one is because it is a progressive kind of problem. It's just going to get worse and worse with time. The third major reason is because, people with venous insufficiency are a little more at risk of developing a DVT and deep venous thrombosis, blood clot.
Scary.
And the typical scenario is when people are on an airplane for a long period of time and they develop a terrible clot, and that's something that people can periodically die from.
You know what's interesting? I don't know, Susan, if you talked about this. But, when I was a kid, when you flew, especially between here and the mainland, they'd turn on the light and the captain would say, okay, feel free to move above the cabin. And now, because of all the travelers, sit down and stay there with your belt buckle all the time.
Seat.
Yeah, but I'm a rebel. I still get up and move around the cabin.
I do too.
Yeah. And I think that now, and this is the reason I asked this, walk through the first couple of treatments you had on this leg that's kind of done for now, and how quickly were you able to just go about your business? Was it the same day? When was it?
And also, maybe you can start out the answer to that question with this. And I'm going out a little bit on a limb because I haven't asked you this before. But what were your expectations with respect to having a procedure before you had anything? With respect to the discomfort and
that's what I was getting at.
All that sort of thing. And what did you really experience? Because that's the other thing. The tremendous deterrent is the fact that I think people feel like they're going to come into the office and they're going to have terrible pain trying to get through these things. Yeah, no,
I thought it was going to be a lot worse than it actually was. So I had myself psyched out. I was nervous. Yeah. I think that most people probably would be. And then after the procedure, I thought, wow. And in fact, I don't know if you remember me saying, is that it? I mean, are you done? Are you done?
Are you done? Yeah.
And I couldn't believe that it was really such a less invasive process than I had imagined. And I was up and on my feet the same day. I'm an avid walker. And in 2 days, I was out on my walks again after the instructions told me that I could be back out.
That's really great. I can tell you that, a lot of times it's like back in my mom's day, it was really, really, really debilitating. And I mean, it was that to the point where the doctor would tell my dad, don't bring the kids here today, come tomorrow. Mom, mom's not going to be very happy. You don't want to see the kids today. And that didn't happen to me one little bit. I was apprehensive a little bit because you can't help that.
Yeah.
So can you tell us, what did you first have done? What was that first day?
The first day they did the back of my leg.
And these are for varicose veins, not spider veins.
For varicose veins. They did the procedure in the back of my leg. They wrapped me and I went home. I went back a second day. You do 3 consecutive days it's a case by case basis. But for me, I had to go 3 consecutive days. The second day that we started working on the front of my leg, and then the third day we wrapped that up, and it was amazing. It was
and Doc, the parting gifts are they get wrapped up for a day or two.
Yeah,
right, and then
Sponge Bath City.
Yeah. but I still think that what you're doing here is when you hear this is an outpatient, that matters a lot, doesn't it?
Mm-hmm. Yeah, sure.
So that was the first experience.
Yeah, that was my first experience. And so it was, obviously, it went really well, because if it didn't, I wouldn't be back for the second leg.
or sitting here talking with us either, But I do know that there's another thing, and Doc, you've said this many times, and you go to the veinclinicsofhawaii.com and take a look at some of these things we're talking about. When it comes time to make your appointment, it's as easy as cake. When you do a real thorough evaluation before any surgery, explain that a little bit, and maybe, Susan, you can show how you felt when you got that. How I felt confident They want to know these guys. They want to know everything. They want to know what I have for breakfast for everything.
Yeah.
Yeah, well, we do ask a lot of questions up front, and we hand everybody an iPad and ask them to go through it. Some people get aggravated halfway through. It's so much, but yeah, I mean, it's important that we know not only what's going on with their legs, but we need to know what other medication people are on, what other medical problems they've had, because a number of those issues impact not only circulation but blood clot activity and all that sort of thing. So the first visit is us getting the patient's medical history. We talk to the patient in addition to our iPad routine. We talk to the patient for a good period of time. And examine the patient, examine the legs, and that's all very, very important. Make sure that there aren't other reasons why they might be having their symptoms. That's what I was big part of it, isn't it? Of evaluating somebody is not only making a diagnosis of one thing, but making sure that it's not other things too. And then from there, then we go on to an ultrasound, and we do a very, very complete ultrasound. A lot of people ask the question, well, are you going to find out if I have any blood clots or not? And the answer to that is yes, obviously, but we do so much more than that. We really spend a fair amount of time on looking at the functional quality of, essentially all the veins in your leg. That usually takes about an hour. Would you say it took an hour for you? And, it's an extensive kind of ultrasound and gives us, most of the information that we need.
But Susan, just out of curiosity, had you had ultrasound in the past?
I had an ultrasound in the past, but not as thorough as this one.
What I loved is being able to look at the screen and have the technician explain, and you put a little pressure on it and it go poof, and you can see. I just felt like that things were being shared to me. I had no misapprehensions and no fear.
Oh yeah, definitely.
Okay, so when you went home that night, were you relieved?
I was relieved.
Yeah, that's
I
great.
was looking forward to the next couple of days after that.
Doc, I do know that there's no perfect way, except when you talked about your primary care physician, when they are on the ball to the point where they know when to recommend somebody go see a dentist or an eye doctor or a vascular surgeon. You mentioned something earlier. And obviously, this isn't something we're going to talk to Susan about because she didn't do it. But when somebody has an ulcer or a hole in the leg that they get treated for over and over again, and it stays the same, isn't that a problem? Shouldn't they be seeing a venous dye?
Absolutely, yeah. When you look at patients that are going to, for instance, wound care clinics. I mean, wound care clinics have become a very big industry because it's such a common problem. But and there's a variety of different reasons why somebody might have an ulcer on the bottom of their leg or on their leg anywhere. But if you look at all people going to wound care clinics, the majority of those people have ulcers due to venous insufficiency. And if you do a lot of local care to that ulcer, can you often get it healed? Yeah, you can. Yeah. But inevitably,
I was going to say, isn't it still lurking under there?
Yeah, if the root cause has not been addressed, then it's going to come back, and we see that all the time. Or people will, a lot of people will treat their ulcers at home, putting salve or whatever on them
for months,
years
sometimes.
Sometimes years. Until they, finally, wind their way around the system and get to us. But, those people, it's imperative that you do a venous study on them.
Yeah, and that's, Susan, why I asked, because like you, like me, it was a family thing. I don't remember my mom having it or my dad having ulcers.
Yeah, me either.
But I did. And I was treated. I was treated for one, and I'm thinking that those that are out there that have a spouse or yourself suffering from this, that's a real sign that there's some serious stuff going on there. Did you know about them?
Oh, I've seen them on people. Like a lot of times you'll see, especially sometimes diabetic people.
Sure.
Will get the ulcers, or a lot of times with the advanced vein disease, like Doc was saying. We'll get the ulcers. I'm grateful I don't have any yet, but I hope I don't.
I'm glad you said yet. Not that you're going to get them, Doc, but knowing what to come. I mean, it's pretty hard to prevent anything. And unfortunately, there's no dietary fix. I mean, you can't say, here, take these 3 things and they're going to eliminate the condition. But it does indicate that you can eliminate the end result or the cosmetic part, and certainly a bunch of the physical part, right?
Yeah. Not everybody with venous insufficiency in varicose veins, for instance, not all of those people, obviously, are going to slowly get worse to the point where they've got chronic swelling and skin breakdown. Very likely you will not. But there's a minority of people that will. But the way that we handle it, there's a couple of things that you can do to try to avoid having further problems of any type in the future. And unfortunately, you're right. It's not based on diet or medication or even exercise, but compression. The evil compression style.
I haven't asked my new friend Susan yet.
Yeah,
and you're wearing your compression.
I am.
Okay. Just because the doc's here, or because you're really
I wear them.
Okay, I wear them.
I wear them. I've worn them since I had the procedure, and it actually on the instruction sheet it says if you can wear them for extra comfort, even after the recommended 10 days are up. Mm-hmm. So I do, and I have worn mine for extra comfort.
Good for you. And the proof's in the pudding. They might be difficult to put on, and they might be. Thank goodness when you take them off, but at least in between, because that's the other thing I was going to ask you about. We didn't talk about swelling. Mm-hmm. One of my big tells, what got me going was my legs, because I was a lot bigger then, really got swollen. Mm-hmm. Did you have any kind of swelling ever?
I didn't have the swelling as much, but like I said, I'm an avid walker. I think the walking sort of helped get the blood flow. I didn't have a lot of swelling, thank goodness.
It's interesting, Doc, because what you said is your ankles and sometimes your knees and stuff, they're kind of little pumps, but they're not a big heart, but they all help.
Right.
So I guess if you use them, Susan did, you're not going to get those.
Yeah, exactly. And there's a term for that. It's called the calf muscle pump. I mean, that's a real term that we use with respect to venous insufficiency. Definitely beneficial. But the other thing I wanted to say with respect to avoiding problems in the future. I tell most people that even after we fix them, it's going to be beneficial for them to, wear some sort of compression stocking, in the long run. Even if they use them just at work, especially people who are on their feet all day long, they're going to benefit tremendously from having that compression. And usually, when we treat people, we've got the full length stocking and they're pretty tight. Yeah. We go down a level on the tightness, and we recommend just a knee-high stocking. That's probably sufficient. The other thing, though, is follow-up. Mm-hmm. And this is one of the other things that we did not do in the past very well. Back when we were doing vein stripping, we'd, do the surgical vein stripping and say, see you later. Yeah. Nowadays we try to get people back every year or so for what we call a surveillance ultrasound to not only make sure that what we have done is remaining stable, but also make sure there isn't anything new coming up, because we're not changing the genetic predisposition for people to have vein disease. So we catch things early, act quickly, and hopefully it doesn't progress into a bigger deal.
I can tell you, Susan, I did this. And once we had, a long time ago, a good friend, a dermatologist, who said, check your birthday suit on your birthday. And so that means annually. And, the dentists tell you as you get older, once a year is not enough. You got to come twice a year. Yeah. And what I'm now looking at is I try to get in quarterly or at least semi-annually for an ultrasound and a look, just because I just feel confident about it. So obviously you're going to add that in your program.
Oh, yes. I plan to follow up. Yeah. Absolutely.
I think you're going to get a gold star on the chart for the stocks already, right, Doc?
Yeah. There's one merit point there already. Yeah.
But honestly, every little bit helps, and I guess that what keeps you going. We should get together again after you, and you're never really done, Doc. But you have a treatment plan for Susan that is inclusive of all the effects that she has from the symptoms.
Sure.
That's going to get dealt with over a period of time, and then you just got to keep a good record, good file.
Yeah, exactly. Yeah, we keep track of all that, of course. We'll call you in a year and and remind you. But Yeah, that would be fun to have Susan back in several months.
Yeah, I think so.
That will,
I'd be happy to.
She'll get the other leg done, and she'll have plenty of time to, recover, et cetera, and we'll get an honest evaluation of where you are right then. But with respect to the symptoms, and everybody's a little different, but the symptoms that you were having in your right leg that we've done already, how quickly did they resolve, do you think? Was it
immediately?
Yeah.
Isn't that amazing? Yeah, it's amazing.
I react to things pretty quickly. My body does, but I was shocked that it was so immediate.
And it's surprising how many people will come back and say that. Now that makes sense when you think about how we're fixing it and the physiologic kind of changes that occur basically right away. So other people don't feel it quite as quickly, but there's a good number of people that, even after the first procedure, they'll come back the next day and they'll say, gee, I can tell.
Susan, you were saying before, you're kind of an avid walker.
Yes.
Were there times where you were not able to do the walk that you wanted before treatment?
I didn't go as long or as far as I do now.
Yeah, and I think that's I don't want to say bucket list, but if anybody has one, if you said, I haven't played golf or I haven't played tennis because I didn't look, but that doesn't mean that I don't want to continue on the effort. What do you like to do? What are you doing more of now than you weren't doing before besides walking?
Walking, I'm doing some yoga now.
Yeah?
Yeah. Trying to do some yoga moves and get my core strong. Yeah.
And I know, Doc, that you'd much rather meet a patient at the health food store than on a gurney. But, it must be gratifying, because we're hearing this from lots of Susans and me's and lots of other people, that they're comfortable knowing that you didn't promise them anything you couldn't deliver, because you're not able to fix the disease, but you can manage it. And I think isn't that a big difference?
Oh, yeah. And that's another thing I tell people all the time. We're not curing you of your venous disease. Yeah. We're managing it. We're going to fix everything that is a potential problem when they first present to the office. We don't promise anybody that, hey, this is it, you're perfect now and you'll never have another problem again, because unfortunately that's not what venous insufficiency is all about, but we keep a very close eye on it and we try to keep it as minimal as possible in the future.
Yeah, it gets me every now and again grinning. I had one on the back of my leg that I never saw. It was my granddaughter. They said, Papa, what's that? And then you see it. And it's ironic because you first had the back of your leg done. Right.
Yeah.
So obviously, did you look in the mirror at times? Oh my goodness! What's that thing following me?
Women always look in the mirror at the back of their backsides.
Yeah. So you did that, and now you must be able to look and say, "See, I fixed that. You're gone."
Yeah.
That's fun. That's why we tell everybody that there's somebody out there that's listening today that's exactly like you, that's gone through and just got to question how much longer am I going to put up with not doing the things that I want to do with the people that I want to do. Right?
Exactly. I would say do it today.
Yeah, that's pretty good. And Doc, it would be neat to have Susan back in after she's done another time.
Yeah, we should.
Thanks so much.
You're welcome. Thank you. Thank you very much, Doc.
And those of you that want to know more, we got the perfect answer. You go to www.veinclinicsofhawaii.com. veinclinicsofhawaii.com. Thanks for listening, and we'll see you again next time.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.